All right, you guys, I'm so excited to welcome today's expert to the interview series that I'm hosting. This is Michelle Lyons. She is actually a friend of mine I've met in the past. I think she is just one of the most well-read physical therapists or physiotherapists, as most of the world says, that I know. I mean, she really knows her stuff. She really goes into the research, and she's also working in clinical practice as well as doing all the research right now. So she's got wonderful book information and real hands-on information, and we are going to get into it today about a topic that a lot of people have asked me about, and that is related to prolapse and different treatment options that are out there, non-surgical treatment options. So I'm going to let Michelle actually introduce herself and open us up with kind of, maybe Michelle, maybe you can tell us about yourself and maybe why you became interested in the field of women's health, and then we'll go into the topic.
So lovely to be here this morning, and always great to see you, Brie. I think this is an amazing job that you're doing, spreading the word to women everywhere, because for so long, pelvic health has just been a secret topic, and hushed whispers, or women have just thought it's normal, that it's normal to leak, or pain is normal, or prolapse is normal, and we have to deal with it. And the reality is we don't. So I'm a physio. I specialize in women's health. I live here in Ireland, but I travel a lot to teach. I teach in the US maybe once a month. I'm in the UK probably once a month. I do a lot of online teaching clinicians. I work online with patients, and then I also have a live practice as well, where I see women dealing with all sorts of pelvic health issues, from pregnancy, postnatal, sexual health, pelvic pain, the whole gamut. Prolapse is one of my favorite things to talk about, and it's one of my favorite things to work with women about, because sometimes the turnaround can just be so quick and dramatic, even though it's a problem that's gone on for ages. And really part of my mission is, I've been a physio for about 25 years, and I've brought in things like, nutrition and yoga and Pilates and health coaching into my work, because I don't think anything by itself is enough.
Yeah.
And I think I really think the future of medicine is that integrative, multidisciplinary approach, where we're really focusing on the person, not the pathology.
I agree.
Yeah, absolutely. Well, I think that's why we get on so well. I think we're on a similar mindset. And I really think, I like to quote, Christian Northrup, to paraphrase her a little bit, because why have women been satisfied with so little for so long?
Yeah.
The help is out there, the research is out there, but awareness is not. And that's why I think having conversations like this is so important, that we can spread the word and really help women help themselves, because that's what we do as healthcare providers. We don't come in and fix people. I'm really into getting people to move from being passive recipients of things being done to them towards being active participants in their own healthcare. And education, knowledge is power, as far as I'm concerned. So all kudos to you for having this service, where we're reaching women on a global level and spreading the word. So
yes, thank you. Well, as you know, I am passionate about pelvic health as well. I actually, in honor of our conversation today, I'm wearing my pelvis necklace. I don't know if you can see that. I love my sterling pelvis necklace. But really, I'm with you. It really does have to be a holistic approach. That's one reason the book that I wrote, Lady Bits, is actually there's a lot in there, but it's because I've learned that there has to be. It's not just one thing. It's not just one exercise that's going to fix things, or one treatment option. There's a lot to it. So yeah, I really want to talk about that today, and I'd love for you to bring in any type of holistic information you can. Maybe you could start us off by telling us, anybody who's not really clear on what prolapse is, what's the definition?
So pelvic organ prolapse, to put it quite simply, it's when the pelvic organs, so for women, that's going to be, our uterus, our
Models,
bladder,
yay!
and, our rectum, start moving into places where they shouldn't be, okay? So they start moving down. And you can have, a number of different types of prolapse. We can have cystocele, sometimes called an anterior relaxation, where the bladder starts to droop down and push against the front wall of the vagina, or a rectocele, where the rectum is pushing against the posterior wall of the vagina. We can have a uterine prolapse, where the womb starts to come down. But even women who've had a hysterectomy, they can have a vaginal vault prolapse, where the top of the vagina, even though the uterus has been removed, we can start to have some descent down through the vaginal canal. We can also have a rectal prolapse, where the rectum starts to kind of telescope down and out through the anus. But more commonly, we're really looking at the organs pressing down on the vaginal walls. And, you know, it's common, it's fixable. There's a number of different options that we can do for that. And it's manageable. And women get terrified by the prospect of this issue. There are different grades of prolapse. And we know that some grades are reversible and other grades are manageable. So there's nothing to be afraid about. It's about seeking a good women's healthcare provider who can help point you in the right direction, help support those pelvic organs where they're meant to be, either by the use of pessaries or by pelvic floor muscle retraining. And then, you know, by looking at what's causing the problem in the first place, because if we're just having a Band-Aid approach, we're not really solving the problem. So for a lot of women that I see with pelvic organ prolapse, a couple of the big drivers are issues like constipation, which is, you know, one of my favorite things to talk about.
Me too.
So it's so important. I think, you know, teaching somebody how to have a healthy, happy, functioning bowel, so important in terms of nutrient absorption and energy and mental health. But in terms of prolapse, it's absolutely vital, because if we're straining to have a bowel movement every day, that places huge pressure on the support network around those pelvic organs. So that's a big driver, teaching women how to lift properly.
Yeah, it's really those everyday things, isn't it? The things that happen over and over. It's usually not a one-time event. Like one time I strained when I was picking up a box. It's the picking up your kid every day and, you know, lifting incorrectly and that kind of thing.
So some women will say, no, I know exactly when it happened. I was lifting something, I was moving a sofa, but it's usually cumulative. Yeah. And ultimately pelvic organ prolapse, it's usually due to a failure of the fascia and the connective tissue. But if the pelvic floor muscles aren't there to support that fascia, that's when we start getting into problems with that. So, you know, we have some vulnerabilities, you know, after we have a baby, but especially when we come to perimenopause, when hormones are changing and the tensile strength of the connective tissue is altered a little bit. But I firmly believe that teaching a woman how to have a good bowel movement daily, you know, good toileting technique, it's a great life skill. Yeah. And nobody really, you know, when was the last time someone taught you how to have a good bowel movement?
Oh, never. Know? I mean, that's never taught. Yeah. That's not discussed. No.
Absolutely. And it's so key in terms of pelvic health, but I would say global health as well. If you have that as a life skill, you know, you're golden in so many regards. So it's one of the first things that I talk about with my prolapse patients is to talk about their bowel habits. What's going on? How often are you having one? Do you have to strain? And what are we going to do about that in terms of nutrition, in terms of coordination of your pelvic floor muscles, positioning, and just the technique for having a bowel movement in and of itself in a way that's not going to raise that pressure in the abdomen and pelvis. So we get to a point where we're...
I'm so sorry, Michelle. She was in my garbage can and making a lot of noise. And so I have to move.
She's just interested in pelvic health.
She really is. Sorry. Yes, okay. But teaching about the nutrition.
Absolutely. So bowel health and lifting techniques, even something as simple as going from sit to stand. You know, we have some really interesting research showing that going from sitting to standing causes more of an increase in intra-abdominal pressure down in our pelvic floor than lifting a 20 pounds weight.
Wow. And I mean, talk about something you do multiple times throughout the day. Every time you're sitting on the toilet, you're going to go from sit to stand, and then
getting out of the car, getting up from the dinner table, getting up from your armchair or your desk. So, you know, we do it about 9,000 times. We can teach women how to have good habits every time they go from sit to stand. Again, that's a really important preventative step in terms of avoiding developing pelvic organ prolapse, but also in terms of restorative work of helping to reteach the pelvic floor muscles how to work properly and then to keep the pelvic organs where they're supposed to be.
Wow. So how would you instruct someone to sit to stand properly?
Okay, so are you sitting now?
I sure am.
Okay, so let's teach you how to go from sit to stand. Okay.
Let me
and this is based on absolutely sit all the way back so we can see you. Perfect. Okay. So there we go. Even better. So this is based on research that was done originally in the late 80s, and then it was reviewed again in the late 2000s and still found to be really, really valid. So what I'm going to get you to do, Brie, is just scoot forwards to the edge of the chair so your feet are on the ground, okay? And have one foot just slightly in front of the other, okay? I want you to take a deep breath in, exhale, and relax your pelvic floor, okay? Now I'm going to get you to take another breath in, and as you exhale, I want you to close your anus and as you stand up. And then relax your pelvic floor again.
Yes. Oh, it feels so good.
That's it. Now,
Yeah. Mm-hmm.
well, you just feel connected. You're exhaling with the effort, so you're using your breath to manage the pressure. Mm-hmm. Now, the PhD level is, can you do it going from stand back to sit?
Oh. Okay. So on the way
let's
down.
Stand. Mm-hmm. So deep breath in, exhale, relax. Okay, let's take another breath in. As you exhale, close your anus and as you sit back down again.
Oh, it's so good. You know, that's really interesting, Michelle, because I have taught the sit to stand part, the first part of that, many times, but actually I've never taught the stand to sit. So thank you. I just learned something wonderful. That's awesome.
Fantastic.
Yeah.
I'm really all about, for me, all roads lead to function.
Yeah.
So I spent a lot of my time reading the research and looking at different papers, but it's then how can we bring that into the real world and into real life situations where you can actually use the research. And for me, just that simple thing of going from sit to stand or stand to sit, real life, practical, but that can make a huge difference in terms of pelvic health and prolapse management.
Absolutely. And I know that you posted an article recently in a group that we're in together online about research is supporting the use of pelvic floor rehabilitation and pelvic floor strengthening for even reversal of prolapse, not just preventing the progression, but also reversal. So can I ask you two things? One would be, can you tell me more about that? And the other aspect to maybe tie in is there a grade of prolapse where it's just not, surgery or some other option may be better than...
Absolutely. So I think if we start with the second part first, and we talk about the different grades of prolapse. So here's a model of a vulva. So this is, a model of a woman's genitalia, the external. We have 4 grades of prolapse, essentially. So a grade 4 prolapse is where everything is coming out. So we've got we call it complete eversion. So everything is coming out like that.
This is amazing. I just want to interrupt you and tell you thank you. Will you put that up on the screen again? I need to get like a screenshot of this. That is fantastic. Thank you. Okay.
Sure. So grade 4 all the way out, okay? Grade 3, it's coming out, but it's about more than a centimeter out, but not a huge amount. Grade 2, it's a centimeter either side of the opening to the vagina. So that's up to a centimeter on the outside or a centimeter on the inside.
Okay.
And then grade 1, there's some descent, but it's more than a centimeter away from the opening to the vagina. And to be honest, a lot of the researchers, people like Dietz in Australia, are saying that grade 1 is so common, after you've had a baby, that maybe we shouldn't even be thinking about it as a pathology at this point.
Can I interrupt really quickly, Michelle? One quick question. Regarding grade 1, if somebody is to tell me that they looked at their vagina, they looked at their vaginal opening with a mirror, and it looked like the inside kind of looked like chewed up bubble gum, that could be the rugae, the tissues of the vaginal wall, and that could possibly indicate a grade 1 prolapse. Is that correct?
It could be. If you're seeing it, it's probably more towards a 2.
2, okay.
Because a grade 1 is going to be more than a centimeter away from the opening to the vagina.
So you really have to open up the vaginal opening to see, okay.
You'd be looking at maybe getting a speculum, or as women's health physios, what we'll do is we'll insert gloved and looped fingers, and we'll depress the walls out of the way, and then we get our patients to bear down, and we can see if there's any descent happening. Then we can grade it, and then we can come up with a plan for dealing with it. Because to go back to the first question, grade 1 and grade 2 levels of prolapse have been shown to be reversible. So absolutely. And what we need to do, so this was great research that was done by Suzanne Hagan and her team in Scotland, and it was published in The Lancet, a very prestigious medical journal, in 2014, backing up a lot of other studies that we've seen over the years, but this is quite high profile. And what she showed was that a combination of pelvic floor muscle training and lifestyle management. So managing your pressure when you're going from sit to stand, being careful with your lifting, not getting constipated, having good healthy bowel movements. That showed a reversal of grade 1 and grade 2. It didn't reverse grade 3, but it significantly reduced the symptoms, which is really what our patients are interested in. I think, a combination of physiotherapy and a pessary when appropriate can be fantastic as well, to kind of, the pessary can go into the vagina and it just lifts things up out of the way, and then you do the pelvic floor muscle training underneath it. It's not just about strengthen though, it's about coordination. Yeah. And we want to make sure that we're getting adequate relaxation of the pelvic floor as well. So it's not just tighten all the time. We want to make sure we've got a good range of movement and it's functional activation of the pelvic floor. So I'm very committed to the principle of exercising the pelvic floor, vertically, dynamically, not just lying down on your back and doing 3 sets of 10, squeeze, relax, because we live our lives vertically and in movement. And I think integrating the pelvic floor with movement, with hip circles, with good glute activation, putting women back into their bodies again and giving them that sense of coordination between the breath and the pelvic floor and the hips and the abdominal muscles. For me, that's a really functional way to rehabilitate a prolapse, and again, give women back that sense of control over their own bodies.
Yes. Oh my gosh. Yes. Yes. Functional movements, definitely. Squats, hip circles.
Lunges,
Hip circles
yes.
are definitely functional. Lunges. Yeah. Yes. All of that. Wonderful. Yes. So tell me, I'd like to talk a little more about pessaries. So a couple of questions here, because actually this is something that is actually somewhat new to me, and these are real questions from me too, not just feeding them to you. They're real. Pessaries are something that women have to be fit with, usually by a gynecologist. Is that correct?
Well, yes, they do have to be fit with, because it's like wearing a pair of shoes. It's not one size fits all. There are loads of different types of pessaries, cubes and rings and gel horns, and it depends on what's going on for that individual woman. In Australia, it's a physiotherapy-led movement where the physios are the ones fitting the pessaries. In Ireland, where I am now, that's within our scope of practice as well, and we're seeing more of a move towards that in the UK. And I think there's growing awareness of it in places like the US and Canada as well, so I think we'll see that following along. And I think it's a good progression, and it makes perfect sense to me, because if we're the ones fitting the pessaries and supplying them and then working on the pelvic floor muscle training, it's like a one-stop shop.
Absolutely.
And we have the luxury of time with our patients, which is, sometimes the gynecologists don't have. Yeah. And I think physios are generally, we're pretty good at that, that interviewing skills and the rapport, and we're also licensed to touch. So we tend to be very functionally oriented. So there's a move globally with that, but I would say, certainly in Australia and in Ireland, we're seeing physios actually, leading the way in terms of fitting and supplying and advising about pessaries.
That's wonderful. I think now I've been out of my home country for about 6 years now, so I haven't been in a U.S. clinic for about 6 years. When I left, I know that we as women's health physical therapists were not able to fit for pessaries, at least I wasn't. So I'm wondering if that has changed. It's something that I need to look into for that day when I do get back to the clinic and back in the United States. So really interesting.
I think it's changing. It hasn't changed yet, but it's changing.
Yeah.
So,
good.
I think there is that growing awareness. And, to be honest, we know that 30% of gynae repair surgeries fail within the first 2 years. So my point of view is that anything that we can do to manage conservatively and to the woman's level of satisfaction, for me, that's the gold standard. So I think physios are a very under-tapped resource. I think we have a lot to offer in that field. And I think, the world of healthcare is changing, particularly in the US. And I'm seeing growing awareness of the role that women's health physios can play with this. The only issue I have is that I think as physios, we're really good at talking to each other and we're good at communicating with each other. We're maybe not as good at getting the word out to the women that we serve or that we could serve. So that's why I think it's great to have conversations like this. So if you are a woman with a prolapse, go ask, go see your local women's health physio. Most places are now direct access in the US. Certainly in Ireland and the UK, you don't need, if you're going privately, you don't need to go see your doctor first. And as licensed healthcare professionals, we're going to communicate with your medical team as well, if that's appropriate. If you need something like a little topical estrogen, if the tissues have had a little atrophy down there, sometimes they just need a little bit of support. And particularly with some of the larger pessaries, a little topical estrogen might be necessary just to help support the walls of the vagina. Much less absorption systemically than taking oral hormone therapy, so a lot safer in that regard as well. And we can talk to you about issues around the right use of lubricants, sexual health issues, managing any other pelvic health concerns that you have in conjunction with your medical team as well. So we, I think, as a profession, we have a lot of enthusiasm and we have a lot of expertise when it comes to helping women with pelvic health issues. So this is not something that you have to suffer with. It's really important to start having these conversations.
Absolutely. And about the pessaries, is it something that women generally use all day long, or are they using it just during exercise? And what do you recommend?
So there's different types. There are pessaries that you can just put in for exercise, things like IncoStress, where you're going out, say for a run, you put this in and then you take it out afterwards. Or Contiform would be another one. There are other pessaries that can be put in and they can be left in for a couple of months at a time.
Yeah.
There are other pessaries that you can just, you take out yourself for cleaning and you put them back in. So that it really is, like the shoe analogy that I use, there are so many different types, and it's about finding, in the same way that, so Jenny Burrell, our mutual friend, whom I teach with quite regularly. So Jenny, when she teaches, likes to wear what I call her lady shoes. They're high heel shoes. They're quite glamorous. My feet hurt even looking at those shoes. Those shoes would not work for me at all. So, I like my comfy shoes when I'm teaching because I'm quite an active person when I teach. So Jenny's shoes wouldn't work for me. Jenny would not be seen dead in the shoes that I wear because for me comfort is queen. So it's different pessaries for different women depending on what's happened. Have you had a baby? Have you had any pelvic floor damage? Are you perimenopausal? All those different things, and that's where having a really skilled fitter of pessaries is absolutely key, because unfortunately I've come across some women and they've gone to maybe a gynecologist or a nurse practitioner who only has tried maybe 2 or 3 different pessaries, and if they haven't worked, they've been told, well, pessaries might not be for you.
Yeah.
And honestly, that's not true. There are dozens of different shapes and sizes, and it's about being patient. Having a pessary inside, you should almost feel like, when you put in a tampon, you don't really feel it. That's ideally what a pessary should feel like. If it's sitting in there and it's irritating you, the pelvic floor muscles are going to get overactive and unhappy. And you're setting up just a whole cascade of unfortunate events.
Yeah.
So comfort is absolutely key, and speaking up with that and having the patience to try all the different types to find the right fit for you.
It sounds like, it's really like trying to find the perfect pair of jeans. It's out there and it's going to be wonderful when you find it, but you may need to try a few different brands, a few different styles, that kind of thing.
Absolutely.
Okay, perfect. Sure. And that brings me, kind of what you ended with there, brings me to another question, which is probably the last question we'll have time for, and then I'll let people know how they can contact you. But my question is, I know that a lot of people it's possible, develop pelvic tension when they have prolapse, whereas we think of this as an issue where the muscles are simply weak and just sort of blah and floppy underneath, not supporting from below. Yeah. But it could actually be that there is some excess tension. Do you see that, and what's the situation there?
So if you can imagine, okay, so the pelvic floor muscles are underneath the pelvic organs, okay, just holding everything up where they're supposed to be. And then we have all the connective tissue as well. So if you think of a boat sitting in a dock,
I love this analogy, yes. Yes.
So the walls of the dock are going to be, hang on, there we go. So the walls of the dock are your pelvis, okay? And the pelvic organs are like the ship, and they're sitting in the pelvis. And the pelvic floor muscles are like the water, keeping everything afloat. But we also have some connective tissue, some ligaments and fascia supporting the organs as well, and attaching to the side walls of the pelvis. what can happen is that if the pelvic floor muscles are weak, first of all, then there's a lot of downward pressure on the fascian connective tissue, and that allows things to descend. But also, if the pelvic floor muscles are too tight, if they're up here, if your muscles are up like this already, there's nowhere for them to go to give you that bit of support, say when you cough or you sneeze or you lift something. And that's when we can run into trouble. So most women don't need pelvic floor strengthening. They need to relearn coordination. But some women do need strengthening, and that's where having a really skilled assessment of your pelvic floor muscles is so important, because like everything else, it's not one size fits all, you know? So that's why having that tailored approach, individual to you, is really important. It's why when I'm teaching pelvic floor exercises, like we did with the sit to stand and stand to sit exercise, I always start with relaxing the pelvic floor, because then it's got more room to close up and support those organs again. And then finish with relaxing your pelvic floor as well, because if you're constantly tighten, or holding those muscles in a very shortened position, it's not functional and they can't support the organs where they need to be.
That's wonderful. It's like the old biceps analogy where you need to be able to go all the way up and all the way down. You can't be spending the whole day like this.
Yeah, exactly. Those inner range exercises. Yeah, it's all about function and having that full range of movement and that ability to not only contract but also to relax.
Oh, this is wonderful. Michelle, this has been a treasure trove of information. I've loved it. Maybe if we could kind of conclude things with just a final takeaway of kind of treatment options for prolapse, what would you say in a sentence or two to anyone who's watching, and also how can people get in touch with you?
Okay, so the first thing I would say is try to avoid getting constipated. Okay, good, happy, healthy bowel movement every day is ideal. Be careful with your lifting. Okay, just try and if you have to lift something, try and just move it with your foot first of all. If you can't move it with your foot, you probably shouldn't be lifting it. Don't be afraid to ask for help.
Yeah.
Practice that knack of activating the pelvic floor, going from sit to stand. And if you have questions about your pelvic health, find a good women's health physio close to you who's going to be able to create a tailored approach for you.
Yeah.
Okay. If people want to get a hold of me, there's some good free resources on my website about pelvic floor activation and about managing constipation. So my website is celebratemuliebrity.com, and I'll send you a link that you can maybe put in the show notes.
Absolutely.
But muliebrity, it's an old English word that means the art and state of being a woman. And I think that's something that we need to celebrate.
Oh, absolutely. Yes. Wonderful. Yeah. And I will also put a link below in the notes below for a lot of women with prolapse are told you can't lift weights anymore. And I know that that's disheartening for a lot of people. But
And not true.
And not true, exactly. And also, I did just create a video that's about high reps and low weight, and it's very safe for people with prolapse. So I'll put some other links in the notes below too. So definitely read the notes. And Michelle, thank you so much. I really appreciate you being here, and we will talk to you later, and we'll talk to everyone else later too. So bye, everybody.
Bye. Thank you.